But scientists we know have been working overtime on vaccines for months now. Now the light at the end of the tunnel is in sight. The FDA approving the Pfizer vaccine for that emergency use authorization. Today, Pfizer is expected to ship out doses to hundreds of sites all across the country. San Diego is expected to get roughly 30,000 of those doses. For now, that's enough to vaccinate 72% of the people that are covered in that first phase, including healthcare workers, staff, and residents at long-term care facilities.
Have to hang in there for long enough to get the vaccine delivered and get people to be vaccinated.
Vaccines could start being administered as early as Monday, and it will be a longer wait, we know, for most of the rest of us. However, officials are expressing some optimism about the rates of distribution, but along with experts cautioning that it will be months before there is wide availability. Joining us live to talk about what those next few months could look like is ABC 10 News reporter Marie Cornell. Marie, the CDC used data to determine who's most at risk and who will get priority.
Yeah, Mary, so they're basing it off the numbers that they've seen, and from there they've put together guidelines which the county has incorporated in their rollout plan.
It's going to take a while, but at least now we understand what the endpoint will be.
The first shipment of the vaccine will go to what they're calling 1A. That includes critical healthcare workers, followed by the residents and staff in long-term care facilities. And then you have 1B, which includes essential workers in education, food and agriculture, fire, police, and transportation. The next is 1C, which goes to adults with underlying conditions and people over 65. Now, while residents in long-term care facilities are in phase 1A, the county says they won't be getting part of that initial 28,000 dose shipment because those doses aren't even enough to cover all first-tier healthcare workers. When it does become available to them, local doctors say it's imperative long-term care residents get the vaccine since they are living in close quarters.
Once the virus gets into one of these facilities, it can spread relatively rapidly before you even realize it's there. And so they're kind of tinderboxes.
Those included in phase 2 of this rollout plan are children and young adults under 30, with everyone else included in phase 3. Now, local doctors warn that even though a vaccine is on its way here, it is still important to continue wearing masks and practice social distancing because they say we likely won't see the impact of the vaccine until the summer. Reporting from home, Marie Cornell, ABC 10 News.